sorry, the video got cut off. So I'm not saying that this is true right now, but for a long time, this was the case. Okay, so we said sleep plays a role, nutrition plays a role. Another big factor, guys, I'm going to say is operant conditioning, right? Children need to be taught in a way to sit still, especially at a young age. When you see 2-year-olds and 3-year-olds who maybe naturally they're a little bit hyper because that's their temperament, but they're being allowed to jump on the bed, jump on the couch, write on the walls, and again, what we learned, permissive parenting. Of course, they're going to struggle with this when they start school. If a child is not given a routine, this is why early education is so important, because kids thrive on routine. So if they're not given a routine to follow at a very young age, right? This is the time we eat. This is the time we nap. This is, the time that we sit still and listen to a story. If they're not taught these behaviors in early preschool, then of course they're going to struggle by the time they get to 1st and 2nd grade. It is not normal for animals, humans, to sit still for 7 hours a day. It's not normal. So the fact that we require this doesn't help with children who are hyper. So let's throw that into the mix. More and more schools have eliminated PE as a requirement. It used to be given every single day. In elementary school, kids had recess or they had PE. Now we're seeing less and less funding going to sports and going to physical education. Some schools only offer it once a week or once every few days. It's shortened, and the extracurricular activities have also decreased dramatically. Kids need to burn energy. They can't be sitting still. They need to play outside. They need to jump. They need to play in the dirt. All of this is good for the development of antibodies and for that energy that they're bottling inside. Okay, so yet another reason why sports are so important is because kids need to burn energy. So what is the opposite of what is being done, which is yet another cause of ADHD, is the fact that most kids are being placed in front of screens. So replace outdoor activity with a movie or TV, or worse, an iPad or cell phone. Guess what? This is addicting. Studies have shown that the lights and how rapid most video games are, not only video games, YouTube, any sort of activity that a child does on a phone. I don't know, because I don't give my kids my phone or tablet. Those activities cause the reward pathway in the brain to peak. The reward pathway is what produces dopamine in our brain. Dopamine is the addictive hormone. It's a pleasure hormone. It's what makes us want to do something more. It's the same reason why casinos have the fancy carpet and the sounds and the lights and everything happening, because it triggers the dopamine receptors in our brain, which draws people in more and makes them more addicting. Whenever we release dopamine, we want to do that activity more and more. So this is what happens whenever a child is placed in front of a screen, whether it's, again, educational or not, whether it's, video games or not. I'm not saying that all technology is bad. Kids can definitely learn a lot from technology, especially with guided participation. If there's an adult next to them saying, oh, wow, what color is that? Let's click on whatever, whatever abcmouse.com, for example, tells them to do. All of this can be beneficial to children as long as it's done in moderation. And moderation in preschool is 15 minutes a day. The American Academy of Pediatrics recommends no electronics whatsoever, no screen time rather, whatsoever before the age of 2. Nobody does this. And they recommend no more than an hour a day from the ages of 2 to 4. Again, nobody does this. I myself am guilty of this. So what tends to happen, guys, I've just given you a whole list of environmental factors that cause ADHD with the, yes, genetic predisposition to being hyper. When you throw all these things into the mix, Also, the fact that most technology, video games are so addicting that it actually takes away sleep from the child. They don't want to go to sleep because they just want to be on their iPad. Now you have a disorder. Now you have a child that needs to be medicated. Does medication for ADHD work? Yes, it works very well. A lot of you are on medication for ADHD. Problem is, there's a lot of problems with medication. Number one, there are no standards for the medication in terms of dosages. So, for example, Tylenol says if you weigh, if you weigh 20 pounds, it's 5 mLs, right? With Adderall, there is no such guideline because it all depends on how severe of ADHD the child has. So what pediatricians tend to do is they start with the smallest dose and then see if that works, and then they increase it little by little. Another problem, tolerance occurs. So the more you take the drug, the more you become tolerant to it, such that 1 milligram no longer has an effect on you. Now you need 3 milligrams. So they have to increase the dose over time in order for the child to have the same effect. They build tolerance. They also build dependence. These drugs are highly addicting. Kids, I worked with children for many, many years. They will come up to me and tell me, "Teacher, I didn't take my pill today. I can't focus." They already know because they have heard it so much and they have taken it for so long that they know that when they don't take it, they can't function and they shut down. They refuse to function. They're hyper and they know it. So dependence happens, tolerance happens. There's no dosage requirements. Guess what's another side effect? Lack of appetite and zombie. Okay, kids literally become so focused that they don't care to eat. They don't really care to talk or be talkative or be hyper. They're just zoned in. They're in the zone. They're tuned in to what they're doing, and it's almost like they've become zombies at that point. Anybody who has taken this type of medication, you know exactly what I'm talking about. Some people actually take Adderall to lose weight. That's how much it decreases your appetite. So children lose weight when they're on this. That's bad because kids are growing. So they need to be able to have an appetite and be hungry. Sometimes, what else does ADHD affect? Sleep. So a child may need to be placed on a sleeping pill or take some sort of additional medication to help them with sleep. Maybe melatonin or maybe something natural could work, but often if they're taking a very high dose of Adderall or Ritalin, it's not going to let them go to sleep. So what am I saying here, guys? All the same things that cause a kid to be hyper are an effect of the medication that's supposed to help them. Okay, so it's causing them to have poor nutrition, poor sleep patterns, zombie out, right? Imagine the kid is zombied and tuned in to an electronic device, which happens. So now that's going to make it worse. And probably the worst the worst side effect of all with these sorts of medications is that we don't know the long-term repercussions. They're very new and studies have not been around long enough to test what happens 40 years down the road, 50 years down the road. If somebody took Adderall when they were, say, 4 years old, 5 years old, right? What we do know is that if a child starts taking these psychotropic drugs at a young age, guess what? They're more likely to try drugs when they're in their adolescent years. Dependence and tolerance, okay? So they've been on Adderall since they were 5 years old. Now they're 18, or 13. Let's try marijuana, why not? And they self-medicate. Let's try, worse, who knows? So again, I'm not trying to say that all ADHD drugs are bad and that kids shouldn't take them. But there are things that we can do to prevent a child from getting to the point that they need medication. And there's also other environmental things we could do, like letting them play sports and stay active and giving them a better diet and better sleep patterns, right? And then if all else fails and you see that the child is still having difficulty focusing, difficulty paying attention, then I would start with the lowest dose possible and try to wean them off as soon as you can. So those are my 2 cents about ADHD. Your book also talks about communication disorders and autism. I have spoken so much about autism already in our class that honestly that would be a whole nother podcast. So I want you to read up about it. I'll put a video up on Blackboard, and that's gonna be it for today's lecture. So if I can, I will try to do this for the remaining 2 chapters. It's been very difficult for me because I need to get a babysitter in order to do this. But if not, I will continue to find helpful videos for you, and we'll take it from there. So have a wonderful week, everybody, and I hope to see you soon.